Hey guys, Dr. Dilip here. Welcome back. And I know you guys will be a bit anxious with regards to what's going to happen with the INI-CET exam tomorrow. But trust me, guys, you have done the hard yards and you have run so far just to reach there. So keep your confidence level high and enter your exam hall with a lot of confidence. And these are my personal favorites with regards to INI-CET exam. Knowing INI-CET for almost a decade now, I can predict certain questions, and these are my personal favorites. Let us start with cardiology and the diagnosis and management of acute coronary syndrome and how to manage a STEMI and STEMI and unstable angina. All of them are going to be very important. Last year also they have asked an ECG with regards to the post-valve myocardial infarction, and you all know that. And arrhythmias and their management is always an INI-CET favorite, especially the AVNRT, the AVRTs, the pre-excited atrial fibrillations, and what not to do in the setting of arrhythmias. All those things are quite important in INI-CET. And myocarditis has always been a favorite topic, and I can expect a question from a cardiac MRI perspective as well with regard to the late gadolinium enhancement and the criteria used in myocarditis, that is the Lake-Lewis criteria. So you might expect those things because this has been traditionally an INI-CET favorite. And CPR guidelines, no need to mention in any exam, this is an examiner's favorite. Last time they've asked a question on post-ROSC management, and INI-CET always tend to repeat the same area over and over again, but make sure that you learn everything about the return of spontaneous circulation and its management. And one update that I want to mention in cardiology is with regards to the mavacamten. That's a cardiac myosin inhibitor. And recently there was an update with regards to mavacamten on HCM as well. It's already been approved, but they tweaked the update a little bit. But nevertheless, the drug as a whole in HCM, and it can be used, can be asked in exam. Coming to endocrine, you know that diabetes is going to be the most important topic in any exam for that matters, especially with regards to the SGLT2 inhibitors, the GLP-1 receptor agonists, and the new one, the tirzepatide, which is very important in terms of obesity, and all those things can be asked in exam. The drug choices in diabetes, please don't forget that. Coming to the thyroid disorders, Graves' orbitopathy has always been an INI-CET favorite. Never ignored that topic. And diabetic ketosis and management is kind of a darling for any examiner, and they might twist the question anyway, they can ask in any way. Just be clear about it. And last year we got a lot of questions from the MEN syndrome, that is multiple endocrine neoplasia syndromes, and from the APS as well, that is autoimmune polyendocrine syndrome, including the carne complex. Please don't forget that. So the MENS, the MEONs, and the APS, never forget. Cushing's, yes, possible. I cannot say with certainty, but yes, it is possible that you might get a couple of questions from Cushing syndrome. And don't forget the pseudo Cushing's that can occur in stressful situations, alcohol, depression, so on. That also is a kind of an INI-CET favorite. And other genetic disorders like androgen insensitivity syndrome has always been a darling for any examiner. And don't forget the Kalman syndrome as well. And a couple of updates here and there. Tirzepatide, which is kind of making headlines after the semaglutide Ozempic saga. So it's a kind of a dual agonist, GLP-1, GIP agonist, very efficient in treating obesity and diabetes as of now. And we have another drug called as crinecerfont. So that has been approved for congenital adrenal hyperplasia, especially in the classic forms of 21-hydroxylase deficiency, which has been effective in reducing the androstenedione levels. And it also effectively reduces the amount of corticosteroids that is required for treating this disease as well. So that could be asked in exam. Don't forget these two drugs. Coming to nephrology, AKN management, especially with regards to the acute tubular necrosis, indications for renal replacement therapy, the AEIOU, and always been an INI-CET favorite. And renal tubular astosis, don't forget the type 1, type 2, and especially the type for the hyperkalemic RTA. All those things are quite important. And the electrolyte disturbance, especially hyperkalemia and hyponatremia, has always been an INI-CET favorite. And complications of CKD, especially with regards to how we are going to manage a CKD patient conservatively, especially with regards to the diet planning of non-dialytic CKD is kind of quite important. I think they might ask about the KDIGO's new recommendations of SGLT2 inhibitors on almost all patients with CKD to reduce the progression of CKD. Could be asked in this exam. And don't forget the complications of renal replacement therapy like dialysis disequilibrium syndrome, the beta-2 microglobulin resulting in amyloidosis, and all those areas. And here's a kind of an update in nephrology. There is a drug called lorundrostat, which is a kind of a aldosterone synthase inhibitor, a novel drug that has been evaluated for the treatment of treatment-resistant uncontrolled hypertension. It's been quite effective. The trial has been released in the last week. And we have amiloride-based trial. So amiloride has been compared with spironolactone with regards to resistant hypertension again, and they proved like amiloride is almost equal to spironolactone in this regards. So these two things can be asked. Coming to neurology, stroke is such an important topic in any exam. You go to USMLE, MRCP, Australian exams, like any abroad exams or Indian exams, you go, stroke is such an important topic, especially the localization of stroke and more importantly, the management of ischemic stroke and TA becomes extremely important. The BP targets for ischemic stroke and hemorrhagic stroke also can be asked. Be clear about that. And other neurological emergencies like status epilepticus and alcohol-related problems like Wernicke-Korsakoff syndrome, and we have alcohol withdrawal state as well. So all those things can be asked in exam. And peripheral neuropathy has always been an INI-CET favorite, and I believe that GBS is such a hot topic right now after the Pune outbreak. So you can expect one question from Guillain-Barré syndrome for sure. And INI-CET has always targeted subacute combined degeneration spinal cord in variety of different clinical scenarios, which will depict either B12 deficiency or probably a copper deficiency. And don't forget that. Here's an update with regards to neurology. They have tried endovascular therapy for medium vessel occlusion. Previously, it's been only for large vessel occlusion. They have tried for medium vessel occlusions and they found no benefit. So the guideline still stands the same. So you have to try EVT, endovascular therapy, only for large vessel occlusions, not for medium vessel occlusions for sure. Coming to rheumatological standpoint, so spondyloarthropathies has always been an INI-CET favorite, especially ankylosing spondylitis. They will ask a lot of questions about Reiter syndrome, psoriatic arthritis, and even enteropathic arthritis. But my hot favorites would be ankylosing spondylitis and probably reactive arthritis. These two are going to be my favorites. And autoimmune vasculitis, quite important, especially the Henoch-Schönlein purpura IgA vasculitis, Kawasaki disease, and Behçet. I believe that this year also the question is going to be repeated. And systemic sclerosis, especially with regards to those antibodies and what are the manifestations, quite important, and maybe treatment of complications of systemic sclerosis and all those. And ANA and associated antibodies are quite important. The patterns and the different antibodies which correlate with various diseases and various problems and all those things can be asked. And with regards to rheumatoid arthritis and SLE, the management part is, I feel, is going to be the most important, especially with regards to how you're going to manage an RA with DMARDs and what are the side effects of those DMARDs. Keep a watch on that. And coming to the update, there has been a trial with regards to obinutuzumab, which is an anti-CD20 monoclonal antibody like rituximab. It's been combined with the standard therapy like corticosteroids and mycophenolate mofetil in patients with active lupus nephritis, and they found a lot of benefit on the addition of obinutuzumab. So that could be a very important point as far as INI-CET is concerned. Coming to the ID perspective, the tropical infections has always been a hot topic in INI-CET. Any tropical infection can be asked, right from your malaria to dengue, to typhoid fever, to scrub typhus, to melioidosis, leptospirosis, any of this can be asked. So keep a watch on those tropical diseases. And HIV, TB, very important. So especially I believe that IRIS part, the immune reconstitution inflammatory syndrome, the latent TB infection and its treatment, the core risk groups, last time they asked that, in HIV and the post-exposure prophylaxis, all those things are going to be quite important. Know about the side effects of those drugs used in HIV and TB as well, especially bedaquiline and its QT prolonging effect and so on. Coming to HAP and VAP. So again, this has been a INI-CET favorite. Previously, they've been asking a lot of questions on community-acquired pneumonia and CURB 65. Now, I think it's time they will shift their focus towards HAP and VAP. Coming to infective endocarditis, the antibiotic treatment, the indication for surgery, and the prophylaxis of IE is going to be quite important in exam. And don't forget the viral and autoimmune encephalitis. Previously, they've been asking a lot of questions on bacterial meningitis and meningeal encephalitis. Now, I think they might shift their focus towards viral encephalitis and probably a variety of antibodies that lead to autoimmune encephalitis like anti-WHO, anti-U, anti-RE, anti-TR, and anti-GAD65 and so on. So, but my personal favorite will be anti-NMDA receptor antibody-related encephalitis and probably anti-WHO encephalitis related to small cell lung cancer. And when it comes to INI-CET, they tend to target sometimes on organisms that you rarely remember, like Burkholderia cepaceae complex. They have asked a couple of times, and Enterococcus treatment, they asked a couple of times. We know the algorithms for treating all these infections, so keep a watch on that as well. And one update, not a very important one, so BCG revaccination has been tried in adolescents to make sure that it's effective in preventing TB in the future or not. The trial came out negative. It is ineffective. That's what the trial is. So that might be a talking point right now in INI-CET. Coming to gastro and hepatology, so treatment of chronic liver disease and its complications, especially with regards to acute and chronic varicose bleed management and management of cirrhosis as a whole and ascites with regards to the sodium restriction and the spontaneous bacterial peritonitis, the SAG values and diuretic ratios, all those things become very important. And IBD treatment, especially keep a watch on those latest advances with regards to ozanimod that's been approved. Then we have ustekinumab. Then we have the vedolizumab. So all those things can be asked in exam. And tofacitinib and upadacitinib has been approved in IBD, not baricitinib though as of now. So that can be asked. And what about esophageal disorders? The echalalia cardia has been an evergreen question, and especially with regard to the findings of high resolution manometry. Keep a watch on that. And other motility disorders like jackhammer esophagus, nutcracker esophagus, and even diffuse esophageal spasm can be asked. And hepatitis B and hepatitis C virus serology, quite important, and treatment, especially for hepatitis B, the tenofovir or entecavir, and for hepatitis C virus, we have the sofosbuvir velpatasvir combination and glecaprevir pibrentasvir combination, and these are nothing but the DAs that are extremely effective in treating any genotype as far as HCV is concerned. All those things can be tested in exam. And alcoholic hepatitis, don't forget, again a hot topic, a hot favorite of any examiner, the matrix discriminant function, the Lilly score, and all those things. And MASH, the NASH has been renamed right now as MASH, that is metabolic dysfunction associated steatohepatitis, that can be asked in exam. And one update with regards to MASH is the fact that resmetirom remains the only FDA approved drug for MASH as of now. There have been a lot of drugs in the pipeline, but this is the only FDA approved drug so far. It's a thyrotropin receptor beta agonist, TR beta agonist. Coming to hemato-oncology, management of anemia, especially the nutritional anemias like iron deficiency and B12 deficiency, always been a hot favorite for any exam, including INI-CET exam. Oncologic emergencies, especially the tumor lysis syndrome, and make sure that you don't mark for urinary alkalization and tumor lysis syndrome, because that should not be done. And hypercalcemia and its management with regards to IV fluids and IV bisphosphonates plus IV calcitonin salmon, all those things can be asked. And SPC syndrome and its approach is quite important. And management of AML-ALL with regards to the management of leukostasis and the chemotherapy regimes that's been used, the modern drugs that's been approved for AML-ALL. Again, a very important topic for INI-CET especially. And management of various plasma cell dyscrasias, especially I believe multiple myeloma and smoldering myeloma is going to be a talking point in this exam, because this has always been an INI-CET favorite and we have discussed in detail in our classes. And daratumab is an anti-CD38 monoclonal antibody, previously has been used in high-risk multiple myeloma patients, but now a trial has evaluated that and have shown to be effective in high-risk smoldering myeloma as well. So previously we have not been treating asymptomatic smoldering myelomas, but now you can treat with daratumab to reduce the risk of progression to frank multiple myeloma, that too in high-risk patients. Yes, this can be asked in exam. Coming to the last one, that is pulmonary medicine and critical care. The spirometry patterns has been always important, and remember, even if the FE1 significantly changes to value of more than 12% or more than 200 ml COPD patient, don't change your diagnosis to bronchial asthma. That's a very important take-home message I want to mention. And pulmonary hypertension has always been a favorite, and currently you can use inhaled nitric oxide for the management of pulmonary hypertension. Previously it was only for ICU patients. Now in emergency situations you can use it as well. And OSA treatment has always been a very important topic in exam. I would say as a whole, it's a very important topic. You know, the gold standard is CPAP, but there have been a lot of new mandibular advancement devices that are coming up. So that could be the potential talking area in exam. And Sagamedex, never forget, with regard to neuromuscular blockade, has been asked quite a few number of times in the last few years. And lastly, an update, that drug called brensocatib, which is a TPP1 inhibitor that has actually reduced the rate of exacerbations, and it has reduced the rate of decline in FE1 in patients with bronchiectasis. Technically speaking, brensocatib at a dose of 25 mg has shown this effect, not the 10 mg one, but that much details are not important. Just remember the drug name alone, that is brensocatib. So I think we have completed the most important things that has to be remembered for INI-CET exam, and these are the updates as well. So keep a watch on those, and wishing you all the very best, guys. Thank you very much.